So what happens is, first, in case of any emergency, if you're in the city radius, usually you call a cardiac center, the ambulance comes fully equipped and everything. So there is a trained technician also coming, and we can get ready for the procedure in case it is a MI and everything. That is MI in the sense myocardial infarction. So we can get ready for the procedure and emergency treatment can be given. So what happens is, if you're going to a nearby clinic, then there'll be a slight time delay. So what happens is, their clinic does not have small clinics, don't have the capacity to give or administer in case you need an angiogram. Or angiogram is just a procedure to view the arteries around the heart and see where the block is, and then trying to open up with the stent. So what happens is, their capability is not there in a lot of the most of the clinics won't have that capability. So what will happen is, they will just prolong your duration. Maximum what they can give us, they can give you that loading dose, whatever is being given, and an injection to thin the blood. That is an anticoagulant. That is the emergency first aid what they can do in case you are having a cardiac arrest or whatever it is, the shock, CPR, all these things can be done. But the same things can be done when a trained technician with an ambulance from a cardiac center comes to your home. So what happens is, the same treatment, whatever is there, it can be done. Waiting time comes down. So instead of going around the loop, it's in case you're not having any cardiac center close by or a cardiac center close by, what you can do is, you can try to go to a nearest clinic or whatever available medical facility is there for the emergency first aid. That should be done, not staying at the home. In case you are in the city and you need emergency cardiac care, it's always better to call an ambulance from a cardiac center who is always ready to deal with these kind of emergencies. So like I'm telling you, one thing they should understand, in case it is a heart attack, the previous precautions, whatever I've given you, not crowding around him, not trying to give him water, or no self-medication, or some ginger water or something like that. All these things should be completely avoided. And one more thing is, sometimes what I've seen in a few patients is, in case they have some chest discomfort or some headache, without checking the BP properly, they tend to think it's probably the BP has shot up. So what happens is, they take their own medications again, a second dose, a third dose, they take it again. So sometimes what happens is, those medications usually act for 12 to 24 hours. So by the time, sometimes under cardiac stress or heart attack, what happens is, sometimes the heart may not pump effectively. What will happen is, the BP will be already on the lower side. That may predispose to all these symptoms. So what happens is, when they are taking all those medications that control BP, the BP may further fall down. It may complicate the ongoing disease. So self-medication or unnecessary over-medication is actually at risk, unless you are surely knowing certain BPs like this. And once you call the hospital regarding this, in case a patient is undergoing any cardiac issues, hospital will be in constant contact with you. So any doubts or issues you are having, you can, by the time that ambulance reaches your home, the doctor will be there to guide you completely. So you can take an informed decision. Never self-medication. When a person is undergoing chest pain and all these things for near and dear, of course, first response is panic. So how to decrease, it's not possible to say you should not panic, but one thing which can decrease your level of panic is knowledge. So you need to have an understanding of what is the condition of your near and dear, or whoever it is, your father, mother, uncle, what is the cardiac status. So based on that, see, when you are going to the hospital, when you're talking to the cardiologist, the cardiologist will give an overall picture as how is your cardiac status or cardiac health of your near and dear. So what will happen is, once you know the overall status of it and what to do in case of an emergency, also we will brief you and everything. In case of any emergency, by panicking, you will only increase the time in responding and calling for help. So in case of an emergency, no need to panic. Immediately call a cardiac center or an ambulance service, so you can come back. So we can talk to you, we can guide you as to, we'll be completely understanding what symptoms you're trying to explain, what can be done maximum first, how fast we can arrive at your place. We will be fully equipped with all the equipment, so our treatment will start at your place. So that is how we can take about it. And not every household, I think CPR should be inculcated at the level of school. It's a basic life support for anybody. For example, it takes only 3 minutes for the brain to completely shut down. So after 3 minutes or 15 minutes, without doing CPR, you bring a patient to the hospital. We try to do CPR after that, or 15-20 minutes after that. And then we try to do CPR, patient gains rhythm, heart, blood flow, everything is there. By the time patient is brain dead. And then one more thing is, when you start early CPR, even American Heart Guidelines say, when you start early CPR, the chance of survival to normal rhythm is actually much better. So CPR is basic skill that everybody needs to know. So I think probably getting well versed, it's a very basic procedure. If done right, it will save your near and dear. You'll be the hero of your family. having a knowledge of what is their cardiac status or what is the health status of the near and dear is always helpful. And one more thing is the basic first aid measures, like for example CPR, or in case of an emergency, what to do. So when your patient is coming to the OPD for a review or whatever it is, or a cardiac condition, we tend to give a lot of suggestions as to what are the conditions that may progress, or what are the possible complications he may get, that we are trying to prevent with already medication and everything. In case of an emergency, how to handle the situation, everything will educate you regarding that. And CPR is a must-known skill. It has to be learned by everybody. It has to be done, and people, a lot of things I see is people are shying away from doing CPR, because there's nothing like doing it correct, doing it wrong. You just need to do it. So as long as you are pumping the chest in the right place, so that some minimal circulation is going around and everything. So I will probably give a better picture about CPR. We'll do a live demo. So the one thing is the person who stays calm in case of an emergency and knows to call for help and knows basic CPR skills, he is a hero. So you will be the one who's saving the person who is in emergency or who is having a cardiac issue. So one thing is always call for help, get an expert guidance throughout, and then get guided by them, and you can do what is necessary first aid at the side of the patient, meanwhile while the help arrives at your place. So that is the best thing we can do. And CPR knowledge is a must for everybody. We are at Frontier Lifeline Hospital, a tertiary level cardiac center. We do heart transplants and complicated angiograms and primary stenting, and all these procedures are done at a day in day out basis. So in case of a cardiac emergency, you can contact us. We'll be the right people to help you.